Hello guys, I am Dr. Prasoon. This is the first live video that I'm doing in YouTube. So I hope you will be able to get some answers related to COVID-19 from this video. Yesterday, all over the world, the number of confirmed cases of COVID-19 has crossed 1 million. That's a huge number and it has never happened before. The US, United States of America, has become the new epicenter of the disease. The pandemic is spreading all over the world and it now has reached more than 206 countries. So I'm receiving a lot of questions from patients, and I'll be answering a few of those questions in this video. If you are joining me on this live session, you can ask the questions in the comment section. You can use the chat section, and I will be trying to answer your questions. If you are watching from Kerala, you can ask questions in Malayalam also. I'll be answering those questions in Malayalam. So the first question, which I have not seen on other videos and on any other platform, is regarding pets. The question is that whether the pets in our home whether they will be able to transmit and spread the disease or not. And the answer is that it is possible to some extent. Suppose you are taking your pet for a walk. We are in a lockdown situation, so we'll have lots of time in our home. If you are taking our pets for a walk and if you are meeting someone, yeah, even if that person you are meeting on during the walk, if that person is sneezing or coughing, and the droplets can land on your pet surface, and if you are bringing back the pet to your home, there is a chance that the pet can act as a carrier. Usually the pets can act as a carrier as a surface and transmit the virus, so there is a possibility. Now, if there is someone in your home who is under room isolation, room quarantined, who is a suspected case or who has not yet undergone any test, in that case also you should not be allowing the pets in your home to enter that room. Uh, uh, social distancing should be maintained from your pets also. And I will also recommend you to bathe your pets every day, frequently, and maintain a good hand hygiene. That's the first thing that we have been hearing about preventing and controlling the transmission of COVID-19 for the last 2 months. And you should always be mindful of what your hands is doing and wash your hands, wash your pets also. So there is a possibility, but the chances are limited. We have not yet seen any pets getting infected, pets coughing or sneezing or anything like that due to coronavirus. No studies have been shown like that. So on the other hand, pets acting as a carrier, there is a possibility, so be mindful of that. So the next question is regarding testing. Okay. The second question most patients ask is regarding a confusion in the period of quarantine, whether the quarantine should be for 14 days or whether it should be for 28 days. We should understand that the guidelines for COVID-19 prevention and control, it has been keeping on changing. One guideline replaces the old one. And thing that we should understand is that we should be updated. We doctors get guidelines very often. Even in Kerala, the guidelines keeps on changing. So in the last month, initially in the first 2 weeks of March, the guideline was that if you are traveled from abroad to India, you should be quarantined for 14 days. And then that was changed after the lockdown. And the change was that persons who have traveled from abroad to India, they should be quarantined for 28 days. So 14 to 28 days is a huge change. When we are trying to push our time and we are finding it very difficult to spend our time, when we are asked to spend another 14 days in our home, it will be very difficult for us. So yes, if you are traveled from abroad to India, And if you travel within March 3rd and March 19th, then you should stay in your home for 28 days. That is good for the community. That is good to prevent community spread. And that is one thing that you should keep in mind. If you have traveled from outside your state to the place where you are right now, that means if you have traveled from another state to the place where you are staying right now, then also the guidelines have changed. Right now in Kerala, if you have traveled from another state to Kerala, then you should be in quarantine for 14 days. Initially, no quarantine was required, but when the lockdown was introduced, this quarantine period has been introduced, and now that period is 14 days. And there is also another restriction, and that is, I think it is in Kerala. If you travel from other districts to the district that you are staying right now, then also the quarantine should be for 14 days. This guideline keeps on changing. You should be following the website of Ministry of Health and Family Welfare, Government of India. You can get all the latest guidelines on that website. For the numbers also, you should be following those website. I will also recommend you to follow and visit the website of World Health Organization. It is who.int. You can also follow CDC, Center for Disease Control website. These are reputed sources of information that you can easily rely upon. So I hope you got the answer regarding the confusion between 14 days and 28 days. Who should be quarantined for 28 days and who should be quarantined for 14 days? The next question is, okay. Uh, Now we are in a lockdown situation, and many persons are not able to go outside for shopping, even for purchasing grocery items. In that case, there are so many volunteers have come up with the idea of delivering grocery items and other household items to the home. So many delivery guys and volunteers have been calling me and asking me whether they are at a higher risk. Of course, they should be maintaining the social distance when they are delivering the package to the home. Wash your hands, wash the parcels, packets, the bags, everything after you handle, and before handling also you should be washing your hands. When delivering to a house where a person is under home quarantine, you should be maintaining a social distance of at least 6 feet. Keep the baggage there and then leave the place. Inform the intimates of the house that the package has been delivered. Don't go in for cash exchange unless you are wearing a mask. Wearing a mask is the next question. We are coming into that. And uh, another question is regarding washing of vegetables and all the items that we have bought from a shop. You should be washing. There is an absolute need for washing your hands before handling such items. If it is fruits and vegetables, there is no need to wash it in soap water and all. Just cold water, running cold water, keep it on a running cold water, and that will be enough to disinfect and remove all the contaminants in the fruits and vegetables. Up to 95 percentage, that will be enough. And you practice hand washing and respiratory hygiene. If there are kids in your home, small kids, you should make it an exercise and practice proper hand washing techniques and show it to them, make them do it, let them practice it, make it an exercise. Then these are small and minute steps, but these will go a long way to keep coronavirus away from your home. And when someone if you are ordering online also, if you are ordering food online, then also if you have received the package, if you have received the food, before opening the food, wash your hands. After opening the packet and making the food ready to eat, then also wash your hands. And after eating also wash your hands. Do it 3 times after making a purchase for making your food delivered online. So that is also important. Every parcel, treat it as a surface through which the virus can reach your home. So always be mindful of that. These are unseen times that we have never experienced in our lives before, and hopefully we will never be experiencing such a situation in our lives. So our mindfulness and all these precautions you should definitely be doing during these lockdown days, and for a long time thereafter also. The fourth question is the fourth question is regarding the numbers, the number of persons who have been confirmed to have COVID-19 in India. That number is increasing, but slowly nonetheless. And the number of persons also is the number of persons who have lost their lives is also increasing. Right now, we are standing close to 2,600 persons confirmed in India, and close to 100 persons have lost their life. And thing is that government in all the states of India, it differs. Of course it differs, but the guidelines for the government to test different persons is different. For example, in Kerala, only persons who have known contact with a person who has traveled from abroad, and those persons, primary contacts and secondary contacts, those who have 4 or 5 symptoms suggestive of COVID-19, they are only getting tested. The other persons are being advised to stay in their home alone. They are not getting tested. Those persons who are under home quarantine, even if they have the symptoms or they have 1 or 2 mild symptoms, they are not getting tested these days. And that is mainly because of the lack of resources that we have. The number of test kits that we have right now is very low, and with those test resources we can only test persons who have more than 4 or 5 symptoms right now. India has ordered rapid test kits. Rapid test kits is different from the RT-PCR test that we are doing right now. Rapid test, the word meaning of rapid is that the test can be done within uh, 10 minutes to 30 minutes, and the result can also be obtained within 30 minutes. Unlike the RT-PCR, which takes almost like 4 to 6 hours for the test result to be obtained. And now that there is a lot of testing going on, the RT-PCR test that we are doing now, it will take almost like 2 or 3 days because of the rush of, because of the more number of samples they are testing in the limited number of public facilities that is available in India. So unlike the RT-PCR, the rapid test takes only little time, 30 minutes. The cost is also less. For RT-PCR test, it is I think it is close to 4,500 rupees for the test, and rapid test takes only about 1,000 to 1,500 rupees for the test to be done. New test is also being tested. It has been sent for approval in India, and that is based on the CRISPR-Cas9 technology. It has not yet been confirmed. It is actually a test paper like material. When it gets approved, it will be huge benefit for India because it is developed in India. It is the first time that such a test is being introduced. Hopefully, that test will be getting approved within the next 1 week. So testing, because of the lack of testing, the point that I was making is that we cannot actually believe in these numbers. There will be a huge number of persons who are asymptomatic, who do not have any symptoms. They are not getting tested also. So if we take the example of Diamond Princess ship, the container, in the initial few days, only those persons who had the symptoms were tested in that ship, and later on close to 100 persons in the ship were tested, and it was found that when all the persons in the test, both symptomatic and asymptomatic persons were tested, almost 20 percentage of the persons in the ship were found to be positive for coronavirus. So we can consider the Diamond Princess model in case of India also. We are not testing everybody now. We are only testing those persons with moderate to severe symptoms right now. If you test more persons, if you're testing everyone who is asymptomatic or those who have mild symptoms, then we can expect at least 20 percentage. So that is at least 20 percentage of those persons who are getting tested is going to be positive. And another thing is that the number of deaths being reported, only persons who are confirmed with COVID-19, those confirmed with coronavirus, those kind of persons who when they go bad, when their condition goes bad, when they die, that cases are being reported. There are a lot of cases who die at home. There are a lot of sorry, there are a lot of persons who die in their home itself, and these deaths are not getting reported, and such unreported deaths, we do not know the reason of their death, and such cases are being missed. And that is why these numbers that we are seeing in the media, we should take it with a pinch of salt. We should actually consider that there are lot many number of cases who are actually carrying the virus, and we should be treating everyone like that also. So that is another thing. That is another question that many persons have asked me. The next question. Okay. The next question is where you can get tested. So if you have the money, if you have the resources, you should be taking it into your own hands. You can test for coronavirus all by yourself. Uh, just inquire your public health facilities, whether ask them whether you are eligible or not. That should be the first step that you should be doing. Ask the healthcare workers, the health inspectors, the ashas, the medical officers in your locality. It could be a primary health center, community health center, any government health center. You should visit them. We should visit that place first, and then ask them whether you are eligible for the test or not. If they consider you are eligible, then they will do the test for free. Otherwise, if you think if they are saying that you are not eligible, you should be going back to your home and doing the quarantine. Then in that case, you can get a peace of mind by doing the test yourself. Thyrocare is one such laboratory which is providing online tests at a rate of 4,500 rupees. I think they are launched only in Mumbai right now, and they will be spreading to other cities, mainly the metros. It will be getting the metro cities will be getting these facilities first. You can order the test by sitting in your home itself, and the laboratory technician will come to your home, collect the sample, and then give you the result online itself. And when the rapid test kits are available in India, you will also be able to buy these tests for 1,000 to 1,500 rupees, and then do the test in your home itself. Uh, you can get the result within 30 minutes. If you find the test to be negative, then you can actually have a peace of mind. You can be relieved. So these are the two places. You can just Google online where you will be able to just put in the name of your location, and then where to test uh, COVID-19 test. Just put those keywords in Google and then search for it, and follow the results that come up in the first page itself. So those are the places that you should be visiting if you are trying to test. Recently, the government has given approval for many private institutions and private laboratories to do the test for COVID-19. You can get the details of those in the description box. I will leave a link to those private institutions where this test can be done. So those are the places where you can do the test right now. The next question is yeah, this is another question which I'm getting. Many patients are asking me whether the public should be wearing mask. The essential services providing centers, the shopkeepers, the grocery shops, the supermarkets, everyone is outside. Everyone is doing their business during the lockdown days. We need to buy our grocery items, and all these items are considered as essential services also. So whether the public should be wearing a mask or not, uh, thing to understand that here is that the guidelines are keeping on changing. So initially it was said that the public need not wear a mask, and the mask should be strictly given for the healthcare workers only. So now the guidelines have again changed. World Health Organization has not yet come up with a statement saying that all the public should be wearing, but they are saying that public should be wearing covering their face, their mouth and nose when they're going to the out when they go outdoors, when they go into the public areas, when they go for shopping and all. They should cover their face with at least a handkerchief or a piece of cloth. That should be enough, even if you are symptomatic or asymptomatic, even if you don't have any symptoms, even if you don't have any fever, cough, cold, sneezing, anything like that, you should be covering your face. Because the mask, the surgical mask, and these handkerchiefs and cloth masks, these are not meant to protect you, but to protect others. So that is the one thing that you should keep in your mind. That is one thing many persons have not yet been able to understand clearly. Ordinary masks, surgical masks, and cloth masks will not be protecting you from the virus. On the other hand, it will be protecting all the persons surrounding you. It will be protecting persons who you come in contact with. Even if you are keeping social distancing and all, practicing all those methods, if you are wearing a mask, if you are wearing an ordinary mask, it will be protecting others more than yourself. And N95 mask, that should be reserved for the healthcare community alone, because these kind of masks will actually prevent the entry of the virus into the body, and those kind of masks should be used by healthcare workers, doctors, nurses, and all the persons who are caring for the COVID-19 patients in hospitals. N95 masks should be reserved for those persons only, and we are going to face a huge shortage of these masks. So if you have N95 masks, if you have surgical masks with 3 layer or 2 layer, then just donate it to your nearest healthcare facility. Visit your nearest public health facility. Visit your nearby government hospital and donate your mask, whatever you have in your hands. You can go outside with just a hanky tighten around your face, and that will be enough. Even if you're asymptomatic, you should be wearing a mask. New York has now close to 95,000 confirmed cases, and most number of close to 2,900 deaths in New York City alone. So in that city, the mayor has come up saying that everyone who is going outside their home should be wearing a mask, and these guidelines will keep on changing whether it is in New York or in India. These are the guidelines that you should be following. Cover your face with anything, with mask or any cloth piece if you're going outside, and just reserve the N95 mask and the good quality 3 layer and 2 layer mask for the healthcare community, because they need it the most. They are fighting the COVID-19 from the front line. If our first line of defense falls, then we are getting vulnerable, we are getting exposed. So let the healthcare workers fight it with all the equipments and all the armors they have. And if government is not able to supply it, then healthcare workers will also be at a higher risk. They will be fearing the fear of infection will be there. So that's it. That's about wearing masks. Are there any other questions?
If mask not available, use hand gloves.
Okay. Uh, better question. Uh, is there anyone online who has any other questions to ask me? I'd be happy to answer it here. How many minutes do we have left?
We have 6 minutes left.
And how many persons are online?
Single one.
Okay. Okay. So not many persons are online. If you have any comments, this video will be on our YouTube channel also. You can ask any questions in the comment section. I hope the questions that I answered in this video will be useful to you guys. Uh, I will talk to you guys in the next one. It is me, Dr. Prasoon, signing off. Take care, stay healthy, stay in your homes, and thank you so much for watching.